Hello, welcome to my channel. I'm Dr. Rabian, radiologist. This is a sonography radiology training channel. I will present different videos could be benefit for physicians and general population. This is the first video about imaging findings in leukemia. The expected incidence of cancer in children under 15 years is 110 to 150 per million children a year, being slightly more common in men. Leukemia is the most commonly encountered cancer and accounts for around 35 to 40% of all cancers at that age. In general, leukemia diagnosis should be suspected in any child with anemia not associated with bleeding, fever associated or not with pallor, dyseromegaly, CVC with anemia and or neutropenia and sometimes with leukocytosis, bone pain not associated with trauma and sometimes associated with cytopenia. Leukemia should be included in differential diagnosis of fever of unknown origin, bone pain not associated with trauma, spontaneous bruising or associated with minor trauma, nasal or gingival bleeding, recurrent infections, lymphadenopathy persisting for more than 4 weeks, or lymph nodes larger than 3 cm, or generalized palpable lymph nodes. And the last one, splenomegaly. Acute lymphoblastic leukemia is defined by the presence of more than 20 lymphoblasts in bone marrow and represent the most common type of leukemia in childhood, accounting for 80% of cases. It predominates in men and occurs most often between the age of 2 to 5 years. Acute myeloid leukemia represents 17% of leukemias. Its occurrence is similar in both sexes with no predominance for any given age range. Although definitive diagnosis is achieved by studying the bone marrow aspiration, but the imaging study, mainly in patients with bone pain and extramedullary involvement, may provide the clinician with valuable complementary information when the first symptoms derive from tissue infiltration and involvement of the hematological series appears discrete and asymptomatic. In this video series, I'm going to speak about imaging findings of leukemia in different parts of the body, including extramedullary manifestations, imaging findings in drugs, including lymphadenopathy, lung parenchyma involvement, pleural involvement, and heart involvement, imaging findings in mammary region, including breast involvement, imaging findings in testicles, and finally bone involvement. All imaging modalities may be used for diagnosis and follow-up of the leukemic patients, including plain radiography, ultrasound, CT scan, MRI, nuclear imaging, and the last one, PET-CT. In the next video, I'm going to speak about imaging findings of leukemia related to extramedullary manifestations. If you like this video, please subscribe to this channel. If you would like to get notification for the next videos, please press the small bell, and if you have any question or video suggestions, please write in the comments. Thank you for your attention.